Okay. You know what I want to start with is the question we asked you this, well, starting last year every time, is about semaglutide, tirzepatide, the GLP-1, GIP drugs that seemingly everyone's on these days, and their effect with SIBO. So I've got a couple of questions I'd like to ask because truly so many people are on them who have SIBO or who we want to test for SIBO. I know it can be tricky to get an accurate test for someone on these drugs. Can you describe that and give us your recommendation of how we can accurately test SIBO on these folks?
My recommendation is it's a disaster in a sense for SIBO. It can work for obesity and for weight loss and all the things that is being, supplied for. But here's the problem. So the primary question is, if you're on a GLP, since it slows the gut down, and we say, hey, slowing the gut down can cause SIBO, does it cause SIBO? I don't know the answer. Number one, because I can't do a breath test when you're on GLP-1. Because if you do a breath test, the lactulose never gets out of the stomach. So you got a flat line, not because it's a flat line, but because the lactulose, glucose never leave the stomach. Part two is I can't put a catheter in there to do the Reimagine study because you can't be on a GLP-1 and be scoped because your stomach's full of food. And even if I get the catheter in there, I'm going to get food in the catheter and it's a disaster for the Reimagine study. And then the third part is, well, if elemental diet means food is absorbed higher up, does that help SIBO? If GLP-1 keeps the food higher up and slower release, maybe gets absorbed earlier in the gut, maybe you reduce SIBO. I don't know the answer to that either, because we can't do a breath test and we can't do the aspiration, so we can't check. So everything is a mystery and probably unsolvable and then even if you have GLP-1 and you have SIBO, if you give rifaximin, when does it get out of the stomach? Does it get out of the stomach? Does the acid break it down because it's been sitting there for a day? I don't know. So yeah, it's a mess.
I have one colleague who recommended, well, try testing, the morning of when you were going to take it again at 1 week. But the thing of it is that I know it takes, a month or more to get to steady state and to clear. So I'm not so sure that's enough time. And then another suggestion that I've heard is to just don't take it for a week or two and then do your SIBO test. I don't know. What do you think about these ideas?
Yeah, so what we recommend people do is to stop it for a minimum of a week if we're going to do a breath test. But I don't have enough patients that I've done that in to be able to say that that's working or not working for the breath test. So really, it's still just big question marks. I'm sorry. I wish I had better answers. I just don't know.
We're all trying to figure it out.